I came to Dr. Glueck for a second opinion. A doctor I was going to wasn't really helping, and he said maybe somewhere down the road you might need a knee replacement. At the time I came to Dr. Glueck, I was walking with a cane, and I showed up for the appointment, and he took the x-rays, and he said, to be really honest with you, you should have a knee replacement now. And he said, I recommend a partial knee replacement. And he said, I said, now? And he said, yes, now. And so I went ahead and scheduled the surgery, and it had just been remarkable this past year of how much better I got and everything. I went back to work after 8 weeks, and I no longer needed a cane, and little by little it was getting better and better. I continued to ride a recumbent exercise bike. My husband and I started off by taking small walks out in state parks and things like that, and we're now up to doing 5 miles at a time when we go out. And it's just remarkable how much different it is compared to when I was walking with a cane, and you know, I was just in so much pain in that. So it was scheduled 2 weeks before Christmas, and everything went exactly as it was supposed to. I met Dr. Glueck before the surgery. We talked about things. I then actually did some research on the internet, and I went and met with the anesthesiologist. I watched a YouTube clip of knee replacement surgery to kind of see what I was in for, and got to the hospital, had no issues there whatsoever. And when they said, the next day they said, well, you're ready to go home. And I'm like, oh my gosh. And so we went home, and I was able to step up on the front porch step and into the house. Now, once I got in, it was a little bit rough the first several weeks. It was, rather painful in that, but it just kept getting better. I went to physical therapy. That went exactly as planned. There was nothing that made this unusual. There was nothing that I had to go back to the doctor and see, I was going for my checkups for the regular times that were scheduled and it was really one of the best things I ever did. And I was concerned because I have a full-time job, but I was able to return to work in 8 weeks without any restrictions.